You know that burning sensation you get after you eat? Well, it actually affects 10 to 15% of the population. Many people know this as reflux or heartburn or something along those lines. Its actual name is Gastro-Oesophageal Reflux disease, also known as GORD. And it's caused when stomach acid flows back into the esophagus, causing symptoms like heartburn. It basically happens when your lower esophageal sphincter, the valve between the stomach and the esophagus, isn't working properly. And by isn't working properly, it's usually due to a decrease in tone, which is basically where the sphincter relaxes too much, or an increase in intragastric pressure from things like a big meal, obesity, or pregnancy. It causes that burning sensation in your chest. Now, this is somewhat important as the acid in your stomach can damage the esophagus over time, which causes inflammation, fibrosis, and sometimes even strictures or narrowing of the pathway. Typical symptoms, like mentioned before, you get heartburn, sometimes regurgitation, it might have a bit of a sour or bitter taste in the mouth. Other symptoms you might get, which are a bit atypical but still exist, persistent nighttime coughing, hoarse voice or sore throat, asthma-like symptoms, and difficulty swallowing. Now, these are important because these symptoms can mimic other conditions, so don't ignore chest pain because it could be something more serious. However, hopefully now you've got a little bit more peace of mind to understand what's going on if you have these symptoms. I'm not going to get into them too much here, but some other conditions that mimic the symptoms of GORD could be acute coronary syndrome, which can just feel like heartburn, peptic ulcer disease, gallbladder or biliary disease. What can you do, or what would a paramedic do if you called them with these conditions? First of all, like you'd expect, they'd get a history. They'll probably ask you questions like, has this happened before? Does it happen after meals or lying down? Most importantly, they'll rule out cardiac causes first. So they'll do an ECG and a full cardiovascular assessment to make sure that it's not ACS. One of the best things you can do is sit upright. This is because it puts less pressure on the abdomen, and gravity also keeps your stomach contents down. Ambulance might give some pain medication or advise for you to follow up with a GP. Now, just to summarize, GORD is acid reflux from a weakened sphincter or high stomach pressure. Typical symptoms include heartburn and regurgitation. It's important to rule out any heart problems first. So if you have a history of heart-related problems, I would definitely consider calling an ambulance. Some other ways to kind of manage it is simple lifestyle changes, smaller meals, not lying down after eating, and managing weight can help. Also, see your GP if symptoms are frequent, which could mean more than once or twice a week.